We'll just very briefly go over the first few slides again. Lots of people just joined. We're looking at cervical musculoskeletal disorders among electronics assembly workers in Beijing, China. They're sitting in lines, they're doing their assembly. We want to determine the causes of these MSDs. High level, cross-sectional, we send out a questionnaire, we get the results back, and we're going to do a logistic regression and structural equation modeling to determine these causal pathways. So for the data sampling, there were 3 assembly facilities in Beijing, China that were selected. 4 out of 12 workshops out of these assemblies were selected. I assumed that there were 12 total, and they selected 4 out of that, but they could have also been 12 per. They excluded subjects if the subject was there for less than a year, if the subject already had a musculoskeletal disorder, or if the subject had an etc. And so there were 928 out of an ungiven number of subjects selected. That's how many they sent the questionnaire to. 752 of those questionnaires were returned and valid. There wasn't a criteria given for the validity of said questionnaire. So the questionnaire consisted of trying to get kind of everything. They wanted the personal factors, such as your gender, age, BMI, etc. Their musculoskeletal symptoms, where they asked for more specific ideas from the past 7 days, and then they wanted their experiences over the past year using a body map. And they wanted to know their work-related factors, their postural, psychosocial, environment, everything. And these questionnaires were completed under guidance of trained investigators. Coming from ME, I'm not sure what that means. I'm not sure if that means something to y'all either. We can talk about that later. So on to the lower level, is we wanted to draw correlations between these risks and the musculoskeletal disorder outcomes. So things that they used were things like prevalence, logistic regression, which they noted is not effective in the study of complex etiological networks, and they proceeded to go ahead and do it anyway. And then they followed up with a structural equation modeling. What is this? I don't know. But this is the diagram they gave for it. And this is a description off of Wikipedia. Structural equation modeling involves a model representing how various aspects of some phenomenon are thought to causally connect to one another. Structural equation models often contain postulated causal connections among some latent variables thought to exist but which can't be directly observed. I don't know what that means either. I talked to someone directly before this presentation, and he or she said that the idea is you start with a hypothesis model, and you have a bunch of studies that have kind of shown a little bit of the causal pathway stuff for these outcomes. And then you just kind of move things around to try and get your model to best fit the data you have on hand, and then maybe propagate that to your own study. And I have no idea what this diagram really means, but I'm sure it's good. Okay, so who hasn't read this study yet? By raise of hand. Cool. What is the results of the study? Like, without even looking at the paper, we should already know what the outcomes are going to be.
Apologize, but I'm assuming creating a system is going to match what they're looking for by the described structural equation model. That's what I got.
Yeah, they found what they found and they were looking for, and they published the paper, so they must have found it. And again, I'm not sure about the statistical methods they were using. We can discuss that later. So results were demographically about half were male, which is nice. They were pretty young people, mostly in their 20s. They had a high turnover rate. A lot of the population had a smoking and drinking type behavior problems. They found that 29.4% had a musculoskeletal disorder, where 16% were within the last 7 days. I'm going to read some of the highlights from the logistic regression results. So the risk of cervical MSDs in females were higher than that in male. The risk also increased with job tenure, as the risk among workers who had worked for 16 years or more were 13.3 times higher than those who had worked for less than 5 years. Subjects who sometimes twisted head frequently had a higher risk. The risk among workers who always need to keep flexed or extended neck positions for a long time was higher than those who never kept these positions. And then workers who felt that work was always required to be done quickly had a higher risk than those who didn't. And there's a series of odds ratios and other things supporting what they're saying for that. And also as a note, any pain within the last 12 months was considered a case in this regression analysis. And then the results from the structural equation modeling, again, reading a little bit from the paper where it says the composite reliability was higher than 0.6, convergence validity was higher than 0.36, whatever that means, which indicated that the observed variables can represent the concept of latent variables. And then the total effects of postural load, vibration, occupation, tension, gender, and job tenure on cervical MSDs were these numbers, ranging from 0.02 to 0.2, respectively, indicating that there were moderate correlations between postural load, gender, and cervical MSDs, while there were weak correlations between vibration, work stress, job tenure, and cervical MSDs. And so those were the results that they found from their statistical modeling. So it turns out that having manual labor can cause MSDs. That's the gist of what I got from this study. So some limitations of this study is we've also obviously got the healthy worker bias. Only those at work were the ones performing the study. Now, there's a lot of self-reporting bias, including recall bias, very significant recall bias, possibly Hawthorne effect. I'm not sure, again, coming back to these surveys were completed under trained supervision. Not sure what that means, but you could have some Hawthorne effect. Good anxious worker type biases. I don't want to make my company look bad type of stuff. And there's just no novelty to this. This is written or before, I guess, published back in 2018. And I'm pretty sure all of these results are things that we already knew. Now, the study is cross-sectional. We're trying to get an idea of the situation of the electronics assembly workers. But I feel like we should already be able to extrapolate what we know of MSDs in general to these situations. Why is this study even needed? What does it even show? So some interesting strengths of this study is that it did reveal an interesting idea to me, at least, that work stress can cause things like bad posture. You can tighten your grip more and cause things like that. And that's an interesting idea they found. They did report most of those limitations that I listed were all listed in the study, which was nice of them. And they had a very pretty diagram. So some questions that I have about this that we'd like to discuss is, are general results of musculoskeletal disorder outcomes enough? Do we really need these specific cross-sectional studies for these specific cases and these specific labor conditions? And then how do we improve the cross-sectional study type such that we can actually use the results we have? And maybe even another question is, how can we search through these cross-sectional type studies without investing too much time in them and being able to find a good one? And we can also talk about specific things of this study that maybe we didn't go over yet.
Something that caught my attention was the 82% response rate, and it's under supervisory conditions. So it feels like that's a higher rate than you normally get in like the manufacturing industry of people responding. So it almost feels like there could have possibly been some sort of pressure added to the employees that take it, especially if they're taking it with somebody nearby.
Very massive study too, it feels like the questionnaire.
Yeah, I'd really worry about it because of the dynamics in China going on right now. But 2017, I mean, we barely get 50% ever anymore.
Mm-hmm.
Yeah.
Can we go back to the pretty diagram? So with SEM, you're not revealing or showing causal associations. You're imposing a causal structure upon the model. And here it's, represented with all those lines. Some of these lines don't make sense. Particularly if you've got the table up above. So they ask a bunch of questions about postural load, that are all, do you have to keep your head twisted or flexed for a long time or frequently? That has nothing to do with vibration. So why has vibration got a causal line going towards postural load? Likewise, there's only a line for job control to the musculoskeletal disorders via occupational stress. But if you've got more control over your job, especially given like the way that those questions are phrased, might make sense to have a direct line there. And so the sense that I got from reading the paper, although a lot of this seems to be happening off screen, is that they tried a bunch of different permutations of those lines and compared the models using model diagnostics. And this is one of those things that you should always keep in the back of your head. It's really easy to have a model diagnostic that just says this model better, this model more predictive. But if the model's causal linkages that you're imposing on it don't make logical sense, then it's probably not a good model. And this has been Kevin's modeling quarter for this weekend.
What made you decide to present this paper?
So my work is at the ME department. We're looking at using neck exoskeletons to support heads. And so I was looking at neck injury related type stuff in the workplace. And this one addressed that. And then I glazed through it and it seemed like it'd be a good study.
You said, I think you're pretty sure that we knew all this already. Did you do any background on that?
What I mean by that is, I feel like we know that manual labor and these types of postures and things cause MSDs. Why did we need this study? Why couldn't the company just look at the postures that their workers were already having and address those like on their own? Why are they trying to show that these postures create these problems?
I'm the literature from neck disorders compared with like low back, carpal tunnel syndrome. You got any impression on that?
Not a whole lot.
So this paper has issues, the cross-sectional and things like that, and you've mentioned several of them, but I don't want us to conclude that structural equation modeling is not a really wonderful tool to be used in a variety of situations, a variety of different projects, variety of different things, as a way to model the potential causal relationships between variables, whether they be measured cross-sectionally, which is not when I would use structural equation modeling, but regardless, it's a really, really wonderful analysis tool. I think to some degree, researchers, whether they mean to do this or not, they use splashy statistics that have nice, pretty pictures to mask other issues that would normally result in some, a reviewer saying, I'm not sure this is really accomplishing what it's supposed to. And you can use structural equation modeling wrong, which I think Kevin pointed out. If you're drawing lines between things that shouldn't be related because the modification indices are suggesting that you should do that, you shouldn't do that, right? Because it doesn't make sense to draw those lines, even though it would fit the data better. So I think that, again, don't just dismiss this as an analysis tool. I don't want anyone to think that that's not a good tool, but every tool can be used appropriately or inappropriately, and there's some issues with how they used it that we've already covered. So.
And to add to that, it's like a super, but a lot of other than this.
Yeah.
Following up on SEM, I tried to download this paper last night, but I told Bubba couldn't get it, so I apologize for my lack of knowledge. Now, is this SEM? Are we forcing causation, or are we looking at correlation, trying to learn from that?
SEM is intended to be a causal modeling technique, but you can use it on correlational data. So they have correlational data here. It's a survey.
So this is a correlation.
This
Map,
model, this
then.
map is correlational in
Okay.
nature. There's nothing causal about it in terms of, this causation is really about experimental design, not about analyses.
Okay, thank you.
Oh, please.
Oh, it's kind of off topic. You can keep going.
Baseball. I was gonna actually pursue that, so let me just go a little further. So we already know that there isn't much data on this sort of thing, therefore, what do we know really about causal modeling for cervical disorder? Obviously not very much, right? The Reba is used here, and I don't know if Reba is emphasized in the Ergo course. Does that mean anything to you? Okay, it's driven primarily by, you know, which factor, which ergo factor? Posture. Is posture the main risk factor for low back by analogy? Not at all. It's a non-validated model. Okay, so this whole thing is based on postural stuff, which has questionable causal relationship with the disorder in the first place. Okay, so when you do a correlation, and it's easy for people to say, oh, yeah, I got that posture right. And somebody who's got pain is gonna say, yeah, I must be doing that. So, you know, they're gonna answer yes. Those are all sources of information bias, which is a huge flaw in this kind of cross-sectional research. So, sorry about that.
So in table 4, as you mentioned earlier, like why not look into what kind of postural loads they go into? It looks like they do observe some variables. Can you maybe expand on some of these? And I see a lot of them are related to the head, which is similar to the research you're doing. Would you have done anything different or looked at anything different related to what they observed?
I don't know enough about the neck or neck injuries to have much of an opinion on that.
I guess like what are these, like the item loading and like p-values, what do they represent? Like during the study? And there's no CR or average values for the rest of the item codes, I guess only one of them.
I can speak to this one a bit. So like the CR and the ABE, I don't know the specific, what statistics they're calculating there, but they're related to the latent variable that those observed values are being used to measure. So like the idea is like the ovals are things you don't observe and you say, all right, so postural load is some concept and we're measuring it using these variables.
Gotcha. Okay.
Y'all might have guessed who I talked to before this presentation about this. Any other thoughts? I mean, my main takeaway from this study is I agree with them completely. The results totally match my ideas of what's going on, but I can't agree with them because of their study. One, I don't know enough about the statistics.
You've got hypothetical constructs and you have observed variables. And you know, when you take a survey, you answer half a dozen questions, right, about something, you know, things that you do or feel or whatever. And those observed variables, observed items that, you know, if you call that an observation, are combined to represent this thing, right? So when you're looking at this model here, the little squares or rectangles, whatever, that point to like job demands, right? Those represent the items on the survey. And job demands is the hypothetical construct that those little squares are supposed to represent in terms of measurement, right? That's how they, you know, how you do that with the psychological construct. For a lot of the things that we measure, it's a one-to-one thing. You measure weight, you have a measure, you know, you have a tool that measures it and measures it really quite well. You may take multiple measurements of that, but you can take the average, but that's, you know, that would be sometimes, you know, considered excessive, but point being is for a lot of these psychological constructs, we don't have a really good tool that can just measure the thing, period. And so we use lots of different other things that we could observe that say, you know what, that, if they have that, they probably have this thing. And if they have this and this and this and this and this, they probably have this thing, right? Or they're experiencing this thing at certain levels. So that's just a quick, review of that for, in case you see another structural equation model or you measure anything that's not got a 99% accuracy in its measurement properties.
You had some really excellent questions. One of which was, if I paraphrase, what can you do to basically improve, there you go, the last one, improve cross-sectional studies that apply to literally every single one of our disciplines. So how do we answer that question?
I think one thing that helps a cross-sectional study is having a very specific question when you go in. Instead of gathering a bunch of data and then trying to find something that fits or find a model that fits. Making sure you go in with a question in mind and try to collect the data that will help answer that. Instead of just collecting data and then doing something.
Hearing two parts to your answer. One is precision of questioning, which I agree. Number two is sound like you're getting into data precision. Probably should talk more about that. I'm looking over to your epidemiology, Dr. Epidemiology over there. What can we do to improve the data?
Let me ask you a little more pointed question. What was their case definition for neck musculoskeletal disorder?
Anything in the last 12 months.
Anything?
That's what the sentence said.
Right. I mean, is that from a data perspective, how much trust do you have in that particular datum for each individual?
Very little.
So what could you have done, even if this was still a cross-sectional study, to improve just that aspect?
One line I might try to think about that doesn't directly answer the question is it's cross-sectional, and some of the statistics is rather complicated for me. I feel like philosophically the cross-sectional doesn't ask for complicated statistics because the data you're getting isn't as reliable as you'd like it to be anyway. So maybe working more on simpler analysis in mind would raise more confidence.
Fair enough, but I also think that there may be a possibility of doing a better job of actually trying to get to those data elements, right? So instead of saying the questionnaire, which included all sorts of body parts, right? And then they're only reporting about cervical spine, pain, anything more than an hour in the past year, right? Would be to neck that down to a tighter time frame, right? To try and remove some of that recall bias and maybe even have some type of structured interview, maybe a physical exam, right? There's other things that you can do that still keep a cross-sectional study aspect to it, but actually really improve the quality of the data, which may also improve your accuracy in relationships that you're hypothesizing there.
Yeah, cross-sectional designs are on a spectrum of well-designed and poorly designed. You can have a really well-designed cross-sectional study, and most people would not complain about the analyses and so forth that you would do with that data because you did a good job. Because if you bring someone in at one time point, that's what cross-sectional really is. It's one time point capturing data. Well, if you capture 15 different types of data that you triangulate around this particular issue that you're investigating, right? That's a really, really good one time point, right? Or you could send out a survey to all your friends on LinkedIn and Twitter and ask them a few, some ideas and then run a structural equation modeling on it. Sure. Right. But that's a very low quality cross-sectional design. So you need to match the design with the question, obviously, but they vary pretty dramatically as to what the quality is.
What can you do to improve the exposure? Yeah, talked about the case definitions, but what about the exposure?
Actually observe what's going on as opposed to just having vague questions about it. Go into the workplace and observe or video or whatever it is to gather actual data, at least to start with posture. I won't tell you force. We talked last week about force monitors you put on, but the first thing you do is actually go to these 4 of the 12 workshops and see what's happening.
But it's super resource intensive.
Yeah, it costs money, but that is the superior, if you want to improve cross-sectional studies, it's gonna be of major value, right? Because right now, we're all sitting here saying, well, people that pain are more likely to say that they had a posture issue. Well, duh.
Yeah.
It would have even defined what their tasks were. This is what they were doing. This is the actual place where they were working at. Even a simple definition like that would have helped to improve your thoughts about what they said or what the questions were.
And I mean, you got 700 workers, they're probably not all doing the same exact job. And so even just like controlling for differences in job description and job role. Would be a stat.
Yeah, I just feel like, hey, look, data, now what can I do with this? It doesn't really lead you to be able to perform an action, to be able
When I
to.
have a lot of data, I could do a structural equation model. That,
Exactly.
and, oh, and you have all these
Integrated
things to
with
represent
200,
things. Let's just see what they're related to. And then, oh, these modification of the system help would make it fit better. Oh, it fits. Yay, let's write it up. So, I mean, that sounds crazy, but that's not far from the thought processes that might have occurred.
So even if it's expensive to measure exposure, one of your options then is also to measure samples of exposure. And the group workers in different groups, so that you're not measuring every single worker. You know, so we do that in industrial hygiene all the time, right? Various sampling and stuff like that. So there's a lot of things you could do to improve that. You could also measure some of the psychosocial variables objectively. Although, and I'm getting, this is really dangerous for me to talk about psychology. Psychologists in the room, but,
Yeah, there is that.
but you know, it'd be kind of interesting to see how the objective lined up with the subjective responses.
I think we're at time.
Hey, can you hear me? Okay, perfect. So I'm Jake. I'm a master's student in OIP, and I am doing my presentation today on a study called Burnout, Engagement, Coping, and General Health of Service Employees in the Hospitality Industry. This study was in South Africa, and they noticed some issues with their restaurant industry. This study was actually done by people in the economics department, the University of South Africa, so not by safety professionals. But they noticed that the economics in restaurants were struggling in South Africa, so they wanted to look at some of the things that could be affecting the employees there, the burnout, coping, engagement, and general health of those employees. They have a section on why they chose to look at these aspects of restaurant employees. So the first thing they touched on was emotional labor, which is when somebody has to show an emotion to do their job correctly. And so obviously when you work in a restaurant or you do anything in service, you have to have a smile and you have to be like, hi, welcome in. We're so grateful to have you here and all this, even if you're not feeling that way. And they noticed a lot of people in restaurants are like really frustrated halfway through their shift. And so they're doing emotional acting. So there's two types, there's deep acting and surface acting. And so they wanted to look a little bit at that, but they were in the paper, it says they didn't have a way to measure that. So they decided to look at burnout and coping instead. Restaurant employees also do shift work, which is when you work off shifts or on shifts and work different times a day. They looked at restaurant employees and bartenders. So sometimes you're working late into the night and you're working with your friend when your friends are at dinner or when your friends are at the club. You're working those times that you don't want to be working because no one else is. And then they mentioned that restaurant employees also have little control over what they do. You show up, certain people walk in, you have no control over who you're working with, what they're going to order, how demanding they're going to be. And so like all of this has the potential for a lot of burnout, a lot of issues with your mental well-being. This type of study, or this study in general, was a cross-sectional design. So they went out and it was a purposive, man, I tried to practice that word so much, sample. So they went out at one specific time on purpose and went to all the restaurants and bars in this one specific area and just surveyed all the employees. So there was no randomization. They did it at this time, and that's all they wanted to do, which has a lot of weaknesses because you're getting one demographic, but you're also getting one time. There's no randomization. You're doing one area. So it doesn't give you a lot of generalization. And then they did a survey sample because they just got one survey from all of these people. So some of their methods is when they went out, they were able to give this survey out to 150 people who are willing to take it. They have no response rate reported in the study. So I don't know if they asked 700 people and only 150 responded, or if they asked 150 people and 150 responded. But they are going up to the people directly and asking them, which probably improved that response rate just because it's harder to say no face-to-face. The tools they used to measure burnout, engagement, and coping and general health were Maslach's burnout inventory, the Utrecht work engagement scale, the cybernetic coping scale, and the general health questionnaire. And they talk a little bit about how these different tools worked in their area and the alpha levels for those. So I completely spaced on doing a demographic slide. So I'm going to do the demographics off slide because I completely spaced it until I was sitting here. So the demographics for the study is they had a 52.7% female population in this 150 people. So that's roughly 77, 76. 68% of people only had a high school education. That was their max education, which is not uncommon in the restaurant industry. And then 11% were English speakers, and then 78% spoke Afrikaans, which in South Africa, certain regions speak a lot more Afrikaans than English. And so it tells you a little bit about that area that they were in when they were taking their sample because of that. So their results tables were really big with a lot of numbers on them, and they're kind of messy. So this section right here is, you could make one table. This section right here, you could make a different table, but they made it one. So we're going to talk about it. So the first thing they did is they took the inventories that they took, which they did for the coping, they did the short 15 item scale instead of the full length scale, which then affected their alpha levels, which alpha levels are a tool that you can use to measure how much it should measure for your population. And they took the means from each tool, their standard deviations, skewness and kurtosis, which anyone in biostats is going to talk about today. So exciting that you get to see those. And then the second half of the table is our correlation statistics. So they took this and they took emotional exhaustion and said, how does this relate to depersonalization? And they gave a number right there. And so anything with these asterisks had a p-value that was significant. So there are a lot of different statistics that they were like, we're going to measure these two together. We're going to see what's significant. And so as we can see, there's just a whole lot. There's a whole host of significant correlations. So I'm not going to go over all of those because there's a whole host. Then they did a regression model with general health as their dependent variable and burnout and coping as their independent variables for this one. And so the first model they just did it with gender, which for me made no sense. When I was talking to Kevin about it, he also said that makes no sense. Why would they do it with just gender? But they did, and it wasn't significant. So then these highlighted ones were the significant variables. And so with this beta coefficient right here, these numbers, this is how much of a standard deviation you would go up if the your general health, which a general health questionnaire, the higher score you have, the worse health you have. And so if emotional exhaustion goes up by 1, you go up 0.21 standard deviations in your general health questionnaire, which they did not report in that table, which I thought they did. So you can just kind of see the things that they found significant in their statistics, and their statistics, and their statistics, and their statistics, which to me, I didn't count. I should have counted how many lines of statistics there were, but there are a lot of statistics. They kind of threw the kitchen sink at it. They had a bunch of data and just like, we need to find something of significance. Here's the kitchen sink. We're going to just run regression until we find something that we like. And in the results section, they just list them over and over and over. They're like, this one was significantly positive. This one was significantly negative. They made interaction terms between each of their things and then tested those in regression. And you can see they found some significant results, which is what they wanted, which is what. So some of the strengths of this paper, thank you, is they have a strong burnout tool. The Maslach's burnout inventory is well respected, and it had strong alpha levels even in South Africa when it was tested there. The general health questionnaire, the same thing. They had a strong theoretical framework. They have a lot of theory that backs up what they're claiming is happening. Some of the weaknesses is obviously cross-sectional, so they can't show any causation. The sampling that they did has a lot of weaknesses in it because they have a response bias. They have healthy worker bias because anyone who is too burned out and not able to cope or are not going to be at work, they're going to be home. Selection bias. And then I think the biggest issue with this paper for me was their question. Like the whole thesis of the paper was the biggest problem because they didn't ask a specific question. They just were like, we've noticed this issue and let's try to figure it out. There was no, we think this is because of this, even though they had a big theoretical framework. They just went out and were like, we're going to take all of these statistics and we're going to try to just find some significance in those statistics. So if they had kind of dived in and like, we really think burnout is happening and a lot, and we think that's affecting things, and we think it's happening because of this, they could have had a lot stronger paper because they could have looked more into that and not into just throwing a bunch of data on a table and calling it a day. I thought of another weakness when I was at home this morning. I can't remember what it was now. So I guess we'll never know. So these are some of the questions I have, but I'm honestly super interested in your questions about it. But my questions were, what did this paper add to our knowledge base according to health psychology, in service employees? How would you have done this research differently yourself? And then how would you like to see research like this done? I went really fast, so we have a lot of time. Emily?
I just have a quick question. I didn't get a chance to read this beforehand, so do you mind just like summarizing your main findings? Because I know they had like a lot of stats and we went through them, but what would be like the main takeaway?
So their main discussion was honestly just that there was issues with how these things affected the general health of the population. Let me see what their lead sentence was because I did not put that on there. Their discussion section was so long because it was just literally anything that was significant. So I think their big thing is they said, taken together, these results suggest that the individuals may benefit from training and coping strategies and stress management. So they did all of this stuff to say that they think restaurant employees need help learning how to cope with their stress, which makes sense.
Over there.
Interesting observation that I made is that we have this design study where we just go out and survey people. And we know that this is a terrible study design, but that doesn't seem to be a general popular idea. Like, I'm pretty confident I've seen several news articles where people like politicians and other schools and stuff have done the exact same thing and brag about it. That's just the observation I made. It's interesting.
Did they differentiate between like burnout between like restaurant workers and like bars since they served to different crowds?
They didn't, and that's actually something I want to talk about if it was brought up. Has anyone worked in a restaurant? I have. Has anyone bartended? Okay, is there a difference between serving and bartending? For me, it was significant. Like, for when I did both, like I did one and then I did the other, they were significantly different in the amount of stress that I had. Bartending was a vibe. You sit back there, you make the drinks, you serve your like one table, two tables at a time, and you're just kind of hanging out, talking to people. When you're serving, sometimes it's just bang, 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 and I was way more stressed. Kat?
And the bartending while you're serving.
I am not.
That's very different than just bartending and vibing. Like just a bar bartending is like crazy.
I didn't differentiate that either.
So.
Between like front of house and back of house workers either, so like staff or like, it's pretty different if you're like. You're been like a bar back, like carrying ice to the bar and like carrying tables.
They didn't differentiate between that either. I don't think they did back of house at all. A lot of their theoretical service studies that they had, which strengthened what their argument was, were from back of house. I may not know that. I thought I read that, but I also could be very wrong.
I mean, questions right out of the gate, which is, what is our participation rate?
It didn't say the rate. It just said it was 150 people, from what I remember.
That is a very interesting round number.
Yes, it is.
And so that's like 9 employees per restaurant. Who's worked in a restaurant with 9 or less?
Me, multiple times.
And the rest of us, no.
Sorry.
That's okay. No, there are such things, but I'm like, what are these restaurants? I mean, this is like mom and pop, very, very tiny things.
But I mean, given that their strategy was like turn up and talk to people and ask them questions, they're probably just talking to the people who are front of house, right? So
I think it does
having
say-
9 servers seems reasonable as compared to like 9 people. in the
But where
whole
does it
place.
say it's front of house?
It just says in this case, waiters, waitresses, and bartenders from restaurants and coffee shops.
Right, and then it says all staff at participating restaurants and coffee shops were contacted.
So,
Yeah, it's probably more that they had a really low turnout and they just had to like lump it together, generalize the thing. So maybe they got 1 from each restaurant. And that's the best way they could categorize people as saying, yeah, bartenders, servers, all these people, but really it was like 1 from each restaurant workers.
The reason I'm drilling into this is because especially in longitudinal studies, cohorts, the participation rate often is not so important because you measure things at baseline, you follow them up to see what develops. Cross-sectional studies, totally different game. If you got 75% are not participating, which is often the case, you're like, okay, well, we know what the 25% who participated look like.
exactly.
Another question I had was like around the time of day. If this is 2 o'clock in the afternoon and it's after rush and everything is chill, they're getting a lot different responses than what you're going to get if it's 8 o'clock at night, everything is going crazy. And, so that was kind of one of the questions I had. There's a lot of different responses that you get just for basic time. This cross-sectional really doesn't capture very well that piece.
a more broad question is, what was the author's goal in, I guess, publishing this paper? Like, I think
Tenure.
if you've ever worked in a restaurant, it's like, hey, it's stressful, but you know, are they suggesting that restaurants should provide like, you know, resources for these people? Or are they suggesting that the shift work should change? What? It's hard to see that their interest in like helping the tourism economy, like it's not super clear to me how their study is gonna affect that.
Yeah, so honestly, from what I understood from like the intro section, is they were worried that the restaurants in the area weren't providing good enough service or happy enough service. And so the tourism was struggling. And so they wanted to study what was going on and try to help the tourism industry instead of looking at it through the framework of the individuals. They looked at it through the framework of tourism, from what I understood.
This town.
I don't know. They said it was restaurants were the part that were struggling in there.
Tourism, it's southwest of Jayburg by 120 kilometers. That's not where the main tourism industry is in South Africa. And it may be a very nice place, but it's not it.
So something I've noticed. Something I've noticed in a lot of these papers is oftentimes the way that they make claims towards importance or, you know, interventions or whatever is through an economic argument, right? But a lot of times, like in this, they say, oh, tourism industry was struggling, and they provide no empirical basis for that assertion. And so you can't just throw lazily like things that are outside your discipline. Like I wouldn't throw away lazy comments about safety. And it's frustrating whenever there are empirically verifiable things that are just thrown out there as a claim to relevance, which may or may not be true.
So you identified theory as a strength. I would say they have terrible theory. This came out in 2008. The currently used measure that has been used since 2000 for emotional labor existed when they did this collection. So having the excuse of, oh, there wasn't a measure of emotional labor is garbage. Because that measure already existed. I've used it many times. I have data upstairs from last year where we measured emotional labor and used it for a presentation at a conference. So it's a measurable construct. The other thing is that usually theory is used to be the basis for making hypotheses. None of the relationships in here are all that unique. Most of them could be very concretely argued and theorized and hypothesized. And so even though they said, we think this is probably related to that, and we think this is probably related to that, take a stand and make a hypothesis. And then that would drive their analysis strategy. Because what happened was they got to their analysis section. We're like, well, we didn't really say what our hypotheses were. So we're just going to put everything that we measured in our regression model, which every single thing you measure, it gobbles up a degree of freedom. And I didn't count the number of variables in those regressions, but this is just one regression.
Yeah.
Right? This is one regression model, and you've got 20 or so, scales in there. And so that's not knocking your power down dramatically. So your likelihood of detecting an interaction of any meaning is reduced dramatically by that. Then if you look at, they've added all these variables and they've explained an additional with their interaction terms, about 8% of the variance in the outcome that they were measuring on, of general health. That's the one, for table 2. And then, what is it? 9% of the variance on general health with table 3 with that regression. So they didn't really find a whole lot. They didn't explain a whole lot, and they didn't have any hypotheses that kind of directed their analyses towards some sort of generalizable question that they could then do. So it's just really not a great study. And if you read this and you thought, oh, I think I want to study burnout and engagement, I'm thrilled, because this is not a great example of good research on burnout or engagement or general health or anything like that. This is actually the second time in Journal Club this has been presented, but not this Journal Club. This was one that was presented in a Journal Club in 2009 in North Carolina while I was there. So I've seen this one before. So I have lots of thoughts on it, but that's, yeah, there's Some problems.
So if I can hammer on about model diagnostics for one more time, like part of the reason why they're kind of claiming, hey, we added these interactions and it got better, is they're looking at R squared.
Yeah.
Thing is, if we took every one of those participants and took the last 4 digits of their ID, of like their driver's license number, and plugged it into the model, it would also increase the R squared.
Yeah, probably by about 9%.
Yeah, yeah, so bigger R squared is not necessarily better. Parsimony is important.
Yeah. Yep, absolutely.
How much would this article have applicability today? Any knowledge of geopolitical stuff in South Africa right now, anybody? You actually do have to know this kind of stuff when you read articles, because it has, you have to, it's just like that prior one on China, right? You have to be really careful with some of this stuff, because you're gonna have external factors that you don't think about, because you think about it in terms of American situation, so.
I also thought it was interesting that they, seems like they just looked at English and Afrikaans speakers, but not Xhosa, which is what most of the population speaks in South Africa. So. that was interesting.
So right now, South Africa has so much corruption that they have rolling grid blackouts lasting 8 to 10 hours in all the major cities. That's how bad it is. If you think about it from the standpoint of being a worker in a closed down restaurant, good luck surviving. And these are small restaurants, apparently, if we're gonna take the data of what they are, so they probably can't afford to buy generators like everybody else is having to, and even if they did, you wouldn't get as much money, because the money went into the generator, not in your back pocket. There's wild stuff going on in some of these countries right now.
Any other questions, comments?
Second question.
I think something that I would have done differently is, like Dr. Allen was saying, have a specific question in theory and go into that instead of just going into lump statistics and see if I can actually find something of, go with a hypothesis instead of going with a bunch of questionnaires and hoping to find something. Is the first thing I would have done differently. I also think I would have probably contacted a bunch of restaurants to see if I could get a bigger population size instead of just going out at one moment.
Mixed methods. Because like something like this seems like a natural fit for like doing the empirical work, but ethnography. Like I think this is the second we've got to mention that, like sit down and observe what actually goes on in these workplaces as a passive observer, so you know what's going on and you don't stick your foot in your mouth.
That's a really valuable piece of advice. That is so true of work. That you always want to watch what the work is, what the workers are doing. To such an extent that if you can do the task, but it's not skilled, you should do it. Because you're gonna have infinitely more, better understanding of what's going on. That happens, but at least observe it.
Anything else? Waiter, waitresses?